can do that. That's true. Yeah, there is, yeah, if you need to. There's my stuff. Just up there, turn right. On something in oh right, oh I see, yes. Yeah. Oh okay. Oh right. Yeah. Oh wow. I did that last night. Oh right, okay, yeah. Some of these oh yeah, no, that's fine. That's fine. I think
Welcome to Kellogg, everyone. My name is David Howard. I'm the co-director of the Global Centre for Healthcare and Urbanisation at GCHU. And I can see that most of you are far more clever than me and managed to bring waterproofs in this light Kellogg monsoon afternoon. So I'm delighted to welcome you all here to Kellogg. I'm here today with Dr. Simon Sadinsky, who's the Executive Director for Education at the King's Foundation, and Dr. Juliet Carpenter, who's the Director of Research at the GCHU, the Global Centre on Healthcare and Urbanisation. The GCHU was founded 2019, but actually the relationship with the King's Foundation with the university as a whole really stemmed around 2010 with the evolution in partnership with the King's Foundation and the Princess Foundation of the Master's Programme in Sustainable Urban Development. This was initiated by Jonathan Mickey in many ways, but it's always been very closely connected with Kellogg in terms of students and staff, etc. So we're delighted about 5 years ago when the centre, or GCHU, emerged from these close collaborations, but it particularly emerged from the research and I guess the teaching we do at Kellogg in the fields of sustainable urban development and evidence-based healthcare. And it was kind of evident to myself and Carl Hennigan, who was the other co-director, that we were spending lots of times in meetings discussing exciting things about new gardens, which are beautiful, but also we were talking about some very clear links, particularly at a time when healthy cities, healthy urbanism was a key part of really looking towards a more sustainable future. So today we will be looking at some more research initiatives in partnership with King's Foundation. We're looking at creating healthy places. And the format for the afternoon will be that I will disappear, you'll be glad to know very shortly. Dr. Simon Sadinsky will say a little bit more about the research going on at Highgrove House and Gardens and also at Dumfries House. And then Juliet Carpenter will have a few questions, I think, about this connection between research and practice. Because one of the key elements of the GCHU and the King's Foundation is linking current research with evidence-based practice and projecting that into a more successful future. So, and after that, I think we'll finish at 5:30. And I think we're being filmed as well, so I hope that's all okay with everyone. Right, Simon, over to you.
Hello, everyone. As David said, my name is Simon. I'm Executive Director at the King's Foundation. I thought what I would do is talk a little bit about some of our existing work, but how what's come out of that has been a really exciting new collaboration that's being done between the King's Foundation and the GCHU over the next couple of years. So a little bit of time, very little, just explaining who we are for those who aren't as familiar. We are an organization that I suppose bridges the built and the natural environment and in turn intersects between education and practice. So our vision and mission very quickly, society of living in harmony with nature to improve the well-being of people and the planet, looking at nature and tradition about how we build contemporary, thriving, sustainable communities. So fairly broad, but thought I could explain a little bit about what that looks like. So for us, we use a bit of a cliche about the sort of virtuous circle of learn, practice, teach, but as an institution, we sort of cut across education and training, about 15 to 16,000 students a year through our programs, which range from primary school and secondary school through to vocational training programs, through to postgraduate and research programs across a range of disciplines, which I'll touch on briefly. And we do that through a host of places. So we have 5 centres across the UK. I'll touch on 2 of them today. 8 permanent centres internationally, and a huge range of projects internationally as well at any given time. But I mentioned education, and I think what's quite useful, hopefully, as I go on in this sort of presentation is one of the things that really sits centrally to us, which we call sort of harmony, if you will, but it's this idea that we have had this tendency, both within education and practice, too often to sort of siloize ourselves, right? We often have a tendency of learning within sort of curriculum vacuums or practicing within professional silos, and our sort of argument is that is inherently unsustainable as we look towards creating a future that addresses the many, many challenges we face around climate change, natural resource depletion, etc. And so what we try to do, both within our education and training, but also our practice, is actually look at the intersections, look at the gray areas that intersect between those areas. We can't have a conversation around sustainable textiles without having a conversation around regenerative agriculture and food systems, without having a conversation around our built environment and how we design communities, right? These things are all fundamentally interconnected, but too often they're either siloed between research and theory and practice or between sector by sector. So our very firm belief, and what we, I think, have found a lot of synergy in this partnership, is this idea that we have to not only create relationships between research and practice, but create relationships between sectors and between disciplines. And that is certainly the case in our education and training, and hopefully the case in our practice and our research, as I will discuss. But to give you a sense, I mean, our work cuts across the built environment, and again, we are educators, but we're also practitioners. So we are working on the development and master planning of new towns, on the restoration of heritage assets in the built environment. We're teaching at the master's degree and PhD level, but we're also training the next generation of stone mason, joiner, timber framer, etc. And doing so with this idea that actually you need to create dialogue, you need to create shared learning across all of those areas. And that applies to whether we're talking about fashion and textiles, science and engineering, hospitality, horticulture, food systems, regenerative agriculture, all of these areas in which we work. One of the things that came, we're celebrating our 35th anniversary this year, but one of the things we learned over that 35 years is that it's one thing to kind of be screaming from the rooftops about a lot of these issues, about the need to take a different look about how we approach where our food comes from, or the approach to how we design and build our communities. But it's that much harder to create systemic change if you don't have examples of that in practice that you can monitor, you can evaluate, you can research, you can convene, and you can extrapolate that hub from which the spokes of systemic change kind of stem. And so for us, that place is a place called Dumfries House. For those of you who haven't heard it, it's a beautiful sort of 2,000-acre estate at Dumfries House in Scotland, which has sort of become our living laboratory, if you will, to roll out on the cliche. But it's this place where we sort of put into practice what we believe in a lot of these areas, work with partners, capture knowledge, and disseminate that knowledge. But to understand, I suppose, Dumfries House, you kind of have to understand the context in which it sits. So it was a private residence, a beautiful Robert Adam designed house, probably most famous at its time for its collection of Chippendale furniture, one of the world's leading collections, spectacular. Through a series of deaths in the family and a series of death duties, it was going for sale and for auction, and this collection of Chippendale furniture was kind of going to be scattered to the globe. And that's where then Prince of Wales stepped in and through a sort of coalition purchased the house and saved the collection. But it really quickly became apparent that this couldn't just become another heritage asset. It couldn't just become another tourist destination, certainly not just another private residence, that because of the context in which it sat, it had to and could be so much more than that. So Ayrshire, where this is based, is one of the more deprived parts of Scotland and the UK. It's an area that was historically heavily reliant on the mining industry, and when the mining industry collapsed, it had a really profound impact on local economic outcomes, educational outcomes, health outcomes, and a range of others. And so when we took over the estate, what we saw was an opportunity to both become sort of exemplar for heritage-led regeneration within the community as a community project, but also for that second level, that the first level being very much community focused, that second level being, here's an opportunity to put into practice what we have been preaching, so to speak, and to create an opportunity to research it, to evaluate it, to bring people from around the globe to that place, practitioners, policymakers, and others, and actually start to create some systemic change in the areas in which we care about. So on the estate now are a huge range of education centres, from science, technology, engineering, and maths to sustainable textiles run with leading industry partners, to aerospace, to hospitality, to regenerative agriculture and rural skills, traditional craft, architecture, applied arts, traditional arts. This huge range, and brings about 8,000 students a year through those at all levels to become that next generation of practitioner. But we also use it as a community asset and a vehicle for bringing the community along with us in the journey. There's this real sense that this couldn't just be something that we were doing for the community, it had to be something that was of the community. It was co-designed, it was co-developed. And so one of the first things that we did when we took on the estate was develop our Health and Wellbeing Centre. And the first thing that we did was convene a huge range of local stakeholders, and that was local NHS, it was GPs, it was pharmacists, it was other healthcare providers, to actually understand what is the need within the local community, where are the gaps, where are the stressors, how can we help provide a complementary service to what was already taking place in the area, and particularly because of the way we approach health and well-being, how could we look at creating mechanisms that help prevent ill health rather than simply treat poor health? So taking a slightly more, what has turned into a version of social prescribing. We probably wouldn't call it that, but that is essentially what we're doing. So out the back of those consultations, there was quite a lot of appetite, a lot of areas that were identified, but a number of core programs that were born out of that. And I won't go into them all, but to give a few examples, there's everything from diabetes and pre-diabetes and weight management. There was fertility, menopause, anxiety and stress. There was chronic pain, fibromyalgia, areas where GPs in the local area were feeling stressed, where they felt they would really benefit from additional services, but also areas that we could work to give participants in the programs a sort of toolkit to manage their conditions over the long term alongside their more formal treatment. And so to give you a brief sense of how those programs work, and this is a bit of background, but participants are all referred to us from local GPs, 8 GPs largely, although they do come from further afield as well, and from pharmacists and other healthcare providers. They join us for between 5 to 12 weeks, for about 3 hours a week. We help subsidize all of that. It's a free of charge service to the NHS, it's a free of charge service to the client. There's no financial engagement in that sense. And when they come to us, it's a combination of education, it's a combination of group work, it's a combination of treatments, working with complementary therapists and others, and then it's this idea that actually nature itself is a vehicle for health creation, and what we are doing on the estate can help create long-term beneficial impact on the participants in these programs. So to give you a bit of an example of one of the programs, the pre-diabetes and weight management program, they get referred to us. They would work with our team of dietitians, they would work with our team of nurses and other practitioners who are both in-house with us from local NHS services, consultants and others. But then they would also go out, for example, and we have a catering hospitality training school on the estate. They would go out and work with our team of education chefs about how to prepare healthy meals. We have a horticultural education center. They go out and work with our team of gardeners about understanding where their food comes from, the principles of healthy eating. We have a regenerative agricultural farm and rural skills center. They go out and work in that center with the farming team, with the educational team, about understanding again where the food comes from, some of those principles. We have an outdoor center and nature-based education center where they would go and work with that team about how do you engage in exercise and movement outside of a formal gym environment, and a range of others. Those are just a few examples. And so actually what we're creating is a system in which they're being given some toolkits through formal engagement with practitioners, but then they're also understanding how the way in which they live their lives, a la social prescribing, can inform their health creation. It's had a huge impact. We measure all of the impact according to the same standards as NHS Scotland, so we're able to compare and contrast. We have really long-standing partnerships with the local health and social care providers. But I would say one of the challenges, and where this program stemmed from, is that was very much a community initiative led first. What we didn't think about is 15 years later, the need to be creating a long-standing evidence base for the approach, right? We measure the impact on the programs, on the people, on the community, but actually, what about this sort of nature-led approach? What about this form of social prescribing? How do we create an evidence base around that? And I think we probably didn't necessarily think about that at the time. It was very much, we need to engage with the local community, we have a role to play as part of this asset. And so as we've learned from that, we've since expanded some of this provision across other sites. One of those, and what we're going to be working particularly with GCHU with, is Highgrove House and Gardens. I don't know if anyone has been there. It's Nancy's house in Gloucestershire. Wonderful, incredible gardens which are available to tour. But in 2021, stewardship of the gardens passed to the King's Foundation and some of the associated areas. And through that, we've taken a lot of what we've learned at Dumfries House and other sites and built a range of education and training facilities, a really remarkable sustainable textiles center we run in partnership with Chanel, which look at a lot of artisan skills for that next generation of manufacturing student in the UK. We have an incredible fine furniture school, craft programs where we work with artisans, but also school children from Bristol and further afield. But what we've seen is that there is an appetite and engagement, particularly around access to the gardens, around this idea of what is that relationship between nature and well-being. We've had local community volunteers and others who are engaging in the gardens start to work with some of our GPs and practitioners and others to see the impact that actually this access has had. And that got us thinking about, well, what we could do with this as we start to develop this program there is really meaningfully embed research into the formation of that center. So we are still going to do the community engagement, we're still going to do all that, but actually, what a wonderful opportunity to work with our academic partners, to work with other institutions, researchers, policymakers and practitioners to actually start to provide an evidence base around some of these approaches. And so that very much is what I will end with. And I can touch on a lot of these themes in some of the questions we have. But we're thrilled to be sort of partnering with the GCHU around a range of academic initiatives and research initiatives. So included in that are seminar series, which bridge health, nature, and urbanism. We're going to be looking at visiting scholars, distinct research projects around some of these themes, but also to be looking at a new DPhil program that can bring students, researchers in to actually explore some of these themes, to be launched in early autumn, where you can get a bit more information. But to give you a bit of a sense of that, what we're hoping is that it's this really unique opportunity from a research perspective to sort of look at that intersection of individual health and community health, and with a particular focus on the role that nature plays within well-being. And intersecting that idea between personal well-being and community health, but then also looking at what are the relevant policy implications of that work. So again, that sort of virtuous circle of learn, practice, teach, we kind of talk about. Putting practice on the ground, embedding research in it to learn best practice, to learn poor practice, to learn what doesn't work, and then training that next generation of practitioner with that knowledge. And so yeah, so providing and pursuing evidence-based research, working again because that GCHU partnership between evidence-based healthcare and sustainable urban development and related research, to better understand the role of social, economic, and environmental factors in improving the well-being of people and communities. So some of the themes within that would be looking at sort of evaluation and impact. How are you capturing data? Looking at integrated health models, looking at social prescribing and nature and well-being, bridging that into nature and the built environment, because we have built environment projects all over the world, in the UK and elsewhere. We have the ability to implement some of this knowledge directly into practice as we look at master planning our communities, as we look at creating our communities. And then looking also at the role that heritage assets and our historic built fabric play around issues like well-being. How can we think more creatively about the role of these assets within community health and well-being? And no doubt many other themes that we haven't thought about yet. So that's sort of what we wanted to sort of hot off the press, as it were, all recently agreed and launching soon. But hopefully what we're hoping is that it is this idea of creating practice, recreating a bridge between practice and research, and in an area that there's remarkable work being done, but there's more work to be done around creating an evidence base for it, and in linking theory and practice in that space. So that's probably enough for me. We can do some questions. Just to bring this with me.
Over to you, Juliet.
Great, thanks. Thanks so much, Simon. That's absolutely fascinating fascinating to hear about all the work that's been going on in Dumfries House and how that's now moving to Highgrove and the collaboration that we're partnering with at the Global Centre on Healthcare and Urbanisation. I think what I'd like to do is just firstly pick up this idea of bridging practice and research, and I wonder if you could say just a little bit more about how that might work in practice and how that can be beneficial for both practice and research, that synergy, if you like.
Yeah, I think that idea of bridging research and practice it was where this whole concept started from. And I think because a lot of our work is engaged in practice, and where a lot of our research or monitoring or evaluation is project focused, it's project specific, and it's looking at the impact of that individual project. I think this provides us with a really interesting opportunity to look over a longer period of time, not just the impact of this as an initiative, but on how we can create an evidence base for that wider sort of systemic change. What is the impact of this approach? And through doing that, hopefully we're able to provide, and hopefully for the students, the DPhil students who join us on the program, is direct linking to projects. We have communities, we have sites, we have assets, we have practitioners across a range of disciplines. And I think that's also what's really important to think about here, going back to one of the early slides, which is that, of course, this is a health and well-being initiative, and of course, this is looking at nature, but we have the ability to link in, well, what is the impact of this on the built environment? Or how does this inform how we think about how we manage our land and our food systems? How do we create more regenerative circular systems? How do we embed some of this learning in our education and training, right? We have 16,000 students a year who we are embedding health and well-being in alongside their formal skills training. So I think what will be really interesting is that interdisciplinary approach, that really holistic approach to bridging education and theory and practice. So for us, this is a really, I think, valuable opportunity to create a system of knowledge exchange. I think we have practitioners who have their knowledge in the field. We have researchers who have an unbelievable knowledge of things that our practitioners won't necessarily have an understanding of or access to. We'll have community members who are having their own views, their own impact that we can bring into those conversations. So I think for us, it's this idea that much like we in our education programs feel really strongly that we often have lost that link between education and practice, that we need to create more meaningful bridges between education and practice. Career fairs are great, but that's not going to really create systemic change. That I think similarly within this, that actually we need to create not just access, but meaningful partnership between practitioners and academia. And I think this program will be an example of that within this space, and doing so hopefully in a way that can both create an evidence base that we can deploy in further research, but also that we can immediately deploy into practice on our projects, and vice versa, hopefully.
Great, I think that leads nicely on to the next question, which is really about these partnerships, the partnership aspect of the project, and how you're hoping to engage the local communities at Highgrove and around throughout with health practitioners and the researchers, that dynamic, if you like, between community, practice and research.
Yeah, I think much like, so at Dumfries House, the first step we did do was bring together practitioners and community. Those were the two audiences, but those were also part of the two voices that needed to be heard before we came up with anything, right? That was, we needed to understand the local context, the local needs, the local systems. And that is the case at Dumfries House, but also in our international projects, or wherever it may be. I think the first step is you need a meaningful partner locally. You need meaningful engagement within the community. So I think where the research feeds into that is bringing in that broader context. And maybe that's where we didn't initially have it at Dumfries House. We had the community need, we had the practitioner need, but understanding, well, what's the need of the wider system? What's the need in a policy sense? What's the need? So I think this is really interesting that it'll bring that component into it. But I think also one of the benefits of partnerships, whether that's partnerships with community practitioners or things like the GCH, institutions like the GCHU, is also that it helps us convene, but also helps us bring that knowledge out beyond the boundaries of where we might be working. I think if you look at somewhere like Dumfries House or somewhere like Highgrove, those initiatives are brilliant and they're having a huge impact on the local community, but without partnership, the knowledge stops there. And so I think what will be really valuable about this initiative is that we can help use not just the DPhil program, but the seminars, the conferences, the visiting researchers, et cetera, to then disseminate that knowledge beyond the bounds of this individual project, but also help create that knowledge exchange going back the other way. So I think for us, the idea that we can take meaningfully embed research into our projects, that this isn't just something that's floating around the edges or dipping in and out, that this is something that from the outset is being designed and co-designed to be a part of the initiative is fundamental. And the community, I stress, probably is central within that, right? It doesn't work without that.
Just thinking about Dumfries House, you gave us a really comprehensive resume of all the wonderful things that are going on there, the different activities, the community engagement with environmental projects, community health and wellbeing, local employment, initiatives, apprenticeships, with the crafts. And I'm just wondering about the lessons and successes from Dumfries House and how you might see those translating into your plans for Highgrove House and Gardens.
Yeah, I think the lessons and success, I would say also a lot of lessons learned about challenges and things that didn't always work, right? So this hasn't all been easy. I think what we've seen, and I think we're even stepping back from Dumfries House to a degree, I think what we've often seen is that there is always this challenge between, we have evidence-based ideas, we have concepts, we have this, what we have learned through practice. So if you take the built environment and why we run programs like our master's degree or why we run training programs in building crafts and in related disciplines, that we've seen that there is a disconnect between sort of anecdotal knowledge, practice-based knowledge, and being able to create an evidence base that allows us to actually inform policy and practice. I think Dumfries House, that journey we've been on with health and wellbeing, it's 2016 really was when the centre launched, but we were doing it before then. I think it's safe to say it was met maybe with a degree of skepticism at first, because it was sort of out with the normal day-to-day practice, and we've certainly encountered challenges along the way in terms of we know this works, we know this is valuable, but actually it doesn't really fit into our framework, or we don't necessarily have the evidence base that will allow us to invest in that, whether that's financially or whether that's otherwise. And so I think whether that is understanding that integrating nature into the built environment is inherently positive, but actually you don't see that happening all that often. And why is that? Partly that's educational, partly that's providing training that gives that generation of practitioner an understanding of that, but I think partly that challenge is also around lacking an evidence base that allows that to be rolled out at scale. And so I think one of the lessons we really learned, and hence this initiative, is actually we need to start to build that evidence base. And I think what's amazing is that there's tons of really incredible work. Kathy Willis, who's at Oxford, has just written an incredible book that touches on some of these themes. We were involved in a project at Alderhay Children's Hospital that was around the benefit of access to nature in a health and wellbeing in a hospital context, and the benefit that can have on patients. But that's not necessarily being rolled out uniformly. What are the obstacles to that? What are the gaps to that? And I think often that comes back to the evidence base. So I think for us, it is one, as I say, it's one thing to sort of scream from the rooftops about the benefits of what we've seen at places like Dumfries House, or in some of our built environment projects, or in our agricultural projects, etc. But unless we can create a network of practitioners and a network of policymakers and a network of academics who can help us create that evidence base, we're going to fall at the last hurdle. And so I think that's where partnerships like this, what we've learned is that partnerships like this, directly linked to practice, can create that slightly more integrated approach that allows us to not just put projects on the ground, but to extrapolate those beyond the boundaries of what we are individually doing.
Absolutely, and I think the partnership with the GCHU and primary care as well, part to play in that.
Hopefully.
It's great. At the GCHU, at the Global Centre on Healthcare and Urbanisation, we're particularly interested in this concept of healthy urbanism. So the concept of health in sort of economic, social, and environmental context, really thinking about this sort of integrated approach to health in cities. And I think that's one of the key interests of the King's Foundation as well. And I wonder what you thought might be some of the key legacies of the work in Highgrove House and Gardens and Dumfries House for the concept of healthy urbanism, and how your work might feed into that and the development of that as a key concept, if you like, moving forward in terms of sustainable urban development.
Yeah, I mean, I think there's one thing you can say about both Dumfries House and Highgrove: they are not urban. Right? These are rural contexts. They are estates. They are what they are. And I think what we often say, people will come to Dumfries House or to Highgrove and say, I mean, this is amazing, but what is the relevance of this to me in X or Y location? And I think what we would say is that it's the principles, it's the methodology, it's the approach. And so I think what we have certainly seen in working on projects in built environment projects in the UK, working on built environment projects internationally, we're doing a really interesting project in Guyana at the moment around in Georgetown, which is looking at that relationship between the built and natural environment, is that these sites, these projects, this research is immediately deployable into other contexts. It needs to be done in a place-sensitive way, it needs to be done in a contextualized way, but actually things like understanding the impact that access to nature and gardens can have is directly relatable to how do we build our hospitals, how do we design our towns and our communities, but even beyond that, looking at, okay, we understand that the way we manage our land in a more regenerative way can have a long-term benefit for both the land, but also for our food systems. But how does that get integrated into the way in which we design our communities, right? And how do we do that in a meaningful way that isn't simply allotments or isn't simply maybe an urban orchard or something like that? It's actually putting nature first in the design of our communities. So I think what we can take is a lot of the lessons that we have learned from these contexts and embed them in projects and practice that are in other contexts and actually understand how it works, how it doesn't. And again, I think that's very much a part of this process of knowledge exchange. And I think the benefit of this collaboration, the fact that it's between evidence-based healthcare, between sustainable urban development and ourselves, is that within that ecosystem, we are looking at everything from food to landscape management to urban design to engineering to architecture across all of these areas, and have the ability to integrate and explore how these areas can be integrated across those disciplines, right? So this isn't simply happening amongst healthcare practitioners. This isn't simply happening amongst urbanists. This is creating systemic change through an integrated approach.
So, yeah, I think that's sort of goes to the core of what we're interested in GCHU as well. Well, fascinating. Thanks very much for that. And I wonder if I could now open it up to the floor. If anyone has any questions, it would be great to hear from the audience here. So first, yourself, and then second in the front row there. Yeah. Oh, the mic's just coming.
Okay. So the Dumfries House seems to be a little bit out in the countryside, and you very much look at well-being for people. But for example, in loneliness, basically there are three major risk factors: migration background, poverty, and health issues. So your granny who can't push her carriage. And my question is, when you spoke of the huge impact, how do those three groups, find out and access Dumfries House and make benefit out of it? Because if it is by public transport or...
It's a great question. It's a great question. So, thankfully I think I can answer it. So I think in terms of those core factors, I think there are a few major populations around Dumfries House. Dumfries House is quite rural, and so we'll get back to transport because that's a very big question. But if you look at some of the key areas you're facing youth migration to Glasgow is about 45-50 minutes away. There's been, and that is, for that population, not particularly affordable as a commuting distance. So you have a lot of the younger community who have left. A lot of these towns post-mining have experienced a huge population decline. And so what you are left with in a lot of these communities is an aging population and a relatively deprived aging population. So one of the initiatives that we run out of Dumfries House, which is good fun but also is very meaningfully integrated, is fortnightly tea dances, which take pensioners, those in care homes, those who live alone, from around the area. We provide free transport. That they come from about an hour and a half away. Every fortnight, about 200 of them. They listen to Elvis. They have our butlers and others do a tea service. They dance. All of that. And while a lovely day, we integrate our health and wellbeing centre into that. So we have our staff going around engaging. It's run in partnership with the council, who provide a lot of the transport and access to those who are most vulnerable and most in need. So I think that's one example of in the loneliness sense of things. I think even when you look at the educational side of things, access is a major challenge, particularly in a rural context, also in an urban context. But so one of the things we learned very early on is that we needed a whole series of minibuses to help support travel and transport. We needed, when we're approaching trusts and foundations and others for engagement around projects, to build in subsidies for transport. We needed, so I think access of all of these things is significant. Obviously, the context of Highgrove is very different, but I think often people think of Gloucestershire and Highgrove as being these areas that are fairly affluent, that aren't facing some of these challenges. That's not the case. There are huge challenges in some of these areas where we're going to be hopefully working with local providers to address some of those similar options, or some of those similar issues. Does that answer the question?
We had a question, on the front row here.
Thank you.
There's a microphone.
Oh, thank you very much. My name is Peter Bennett. I'm a human scientist from Oxford, and also a human ecologist, both human science and ecology. And I'm also a practitioner in policing. So, some 40 years ago, I was trying to develop a concept of ecological policing, which I'm concerned to learn from today, at least, that you don't seem to include policing in health and care and well-being. I hope you do.
We certainly do. We certainly do. I just had only 15 minutes. We do a lot. Couldn't cover it all. No, so to give you an example, we very recently held a roundtable with the Scottish Violence Reduction Unit, which is run through the local police, which is around engaging young people, and particularly young people who are at risk, and the local police force in these challenges. We co-design programs with the local police force. We have a very strong relationship with them, but also from further afield. We run weekly programs with police cadets and others. So we are very much engaging with them. I would say I'd be fascinated to learn more about what you had in mind and whether that could be integrated. But I think when I say one of the first things that we did was convene local stakeholders, and I gave the example of health and wellbeing, that was also the police. That was also all of the other service providers within the area, and collaborations and projects were born out of those conversations. And while we don't have, I would say, a specific health and wellbeing and policing initiative, we have initiatives that work with a lot of young people and older people that are underpinning that is health and well-being. Health and well-being, I think, is safe to say sits across almost everything that we do. Some are more explicit, and some are less so. So I don't know if that answers as well, but hopefully.
No, I'm pleased to hear that. If I might have a supplementary whilst
Please.
I'm living in Devon. Devon is being bombed by new towns, and I just wondered whether you've had any involvement in any of those.
To get one of our architecture team up in. We do projects. We do a lot of built environment projects. I think where we often come into the community engagement phase, so that listing individual projects, one of the things that we run is something which we call inquiry by design, and it actually informs a lot of the way that we'll be looking at projects like this. And this, I think, is this idea that often within built environment projects or other projects, again, going back to that sort of siloed nature, you have communities doing their thing, you have the architects and the developers doing their thing, the council doing their thing, the engineers doing their thing, and very rarely the opportunity for all of those voices to come together. So our inquiry by design process is something like a community charrette, for lack of a better term, but is where we quite purposefully bring together all of those components. We also we did a toolkit, really wonderful project called BIMBY, Beauty in My Backyard, but it was actually purposefully a toolkit that communities could take that would allow them to create community plans that would enable them to bring those community plans to local councils, developers, and others and say, this is our vision, this is my vision. So I think, again, much like our heritage projects, much like our other projects, I think that idea that communities need to sit at the heart of our engagement is very much the case in our built environment as well.
Thank you.
We've got a question here in the front row and then halfway back. Thanks.
It fascinates me that urban architecture totally ignores the work of Professor Steve Jones, an evolutionary biologist, who showed, I think in the 1980s, that the incidence of 11 major diseases, irrespective of whether you're in an agricultural community or in an urban community, increases anywhere north of Birmingham, i.e. the light incidence that you're able to absorb, and anywhere north you simply won't get enough to avoid these 11 major diseases. And yet we're recreating those conditions south with tile block cities. And it's just extraordinary to me that that's not on every urban planning decision makers thing, that, you know, we are building ill health in from the very beginning if we don't give everybody direct access to direct sunlight.
I don't know if you know anything about our approach, but you are very much singing from our hymn sheet. That is, I think there is this real sense, and we did reports on the benefits of mid-rise housing, on the way in which you design communities for things like access to light, access to nature, all these areas. So I think at the moment there is this challenge with the way we build and design our communities. There certainly is a challenge that I think is fairly well understood, if not integrated, in some of the challenges that building high-rise developments, in building a lot of the ways in which our contemporary development takes place. I probably have a long conversation with you, that was what my PhD was on. But certainly I think, yes, agreed, would be my answer, I suppose.
It's not just light, it's direct sunlight.
Yeah, no, very much. I think that's absolutely right. And I think it's about how you integrate access to outdoor communities, it's how you integrate play, it's how you integrate all of the elements that come together. I think what we would probably argue is that through looking at our built environment as more of a ecosystem, you could address some of those challenges.
Yes, what's that?
You were talking about your architecture team, and I wondered whether you're working with the RIBA and the Architectural Association so that all these good things aren't just add-ons afterwards, but something that's actually integrated into their teaching.
Yes, is the answer. We do. So we have collaborations that we work with. REBA, we in roundtables, policies, seminars, papers, research, things like that as well. We run CBD programs, we do other things as well. So yes, is the answer. We do have partnerships that are both formalized, but also strong relationships with those who are working there. I think there are probably more we could do in that space, but I think one of the roles that we see is, to a degree, a convening ability. So at the best of our ability, what we feel strongly about and what we do through the GCHU and through things like our seminar series and things like that is actually getting people in a room together and forcing, if you will, dialogue amongst those. So yes, we are very much both, I would say, working both outside and inside of the system as best we can.
Any other questions at this point? Oh yeah.
Thank you. My name's David Shannon. I am intrigued by your study methods in that you obviously have a look at the impact of what you do to the people who you influence. Do you have a sort of do-nothing test group that people you don't touch who may emigrate or go somewhere else, whether they're better or worse off than the people you interact with?
I would say yes and no. I think that if you were to look at Dumfries House specifically, I think because community engagement, community impact, and the need for it to be a site that is creating what we call heritage flow regeneration or whatever it is, I think it is how can we impact the most people in the most way. I think what's really interesting and probably what we'll learn through this partnership that we're at the beginning is actually looking at how we can take some other approaches within that. And so I think for the most part, at the moment, a lot of our impact work, a lot of our evaluation, a lot of that is on those we impact and not on those we don't, as it were. But I think we will probably look at that, particularly as we explore some of these DPhil programs, as we explore visiting researchers and visiting fellows. Interestingly, we do wellbeing walks, to use a very simple example, and we do a lot of work around what is the impact of those who have been on these wellbeing walks. We're working with a really interesting scientist based out of the Netherlands on that. But actually, as a part of that, we're also going to be looking at, well, what is the impact on those who haven't been on these wellbeing walks and who haven't engaged in these processes to help provide a bit more of evidence base. I'm not sure if that answered your question or not, but I would say probably not to the degree that you would be thinking. But that is something, hopefully, through this new collaboration, we can do.
Can I just add to that? I'll shout if I won't. Yeah, and I think that's really important. So obviously we want to look at comparative areas that are not maybe having the same type of building policy or health policies. So we've been working in the GCHU on healthy new towns, and in the UK there are 10 healthy new towns sort of devised over a decade ago. Then COVID arrived, and there was very little research done on are healthy new towns actually healthier. So in the study we're looking at 2 healthy new towns in Oxfordshire, Elmsbrook and Barton Park, and you're looking at then 2 comparator sites that weren't under the healthy new town plan. So you can make some type of comparative analysis of are healthy new towns healthy, which is the name of our research project. So there we go. What are the new towns healthier? Sorry.
No, that's actually a great example. Yeah. Yes. He answered it far better than I did.
Yeah, another question back there.
I need to know whether does the King's Trust support retrofit schemes? Because I remember that Dispatches documentary last year revealed that a shocking proportion of the properties on the Duchy of Cornwall estate, which were down Devon and Cornwall, had EPC ratings of D or less. And I don't want to get the politics of this, but I just find it really odd that considering how long King Charles has been promoting the Green Agenda, why he hasn't been able to do something about it before now. He must have enough clouds of influence to get experts to go and get something done, unless you just retreat by usually, I would imagine you can't do anything with period properties. Well, don't would imagine, make it happen.
Yeah, no, I think we certainly do work within retrofit. We have a number of historic properties, be that Dumfries House, where we're going along that journey at the moment, and it is not without its challenges. But also in our built environment project, we had a roundtable here last year that was all about retrofit and brought together experts from across the sector and across disciplines, specifically looking at retrofit. We have conservation architects, we have others who are very much engaged in that space. So I would say actually, I can't speak to the wider ecosystem, but I can say that the King's Foundation, retrofit is something that is very much on our mind and on our agenda, and something that we are very mindful of, and both working on, but also hoping to continue to do better on.
Can I have my second? And also next October we're running a summer school, an autumn school with the King's Foundation over retrofit, renew, recycle and retrofit. So that's on October the 7th to the 10th I think, but don't come to the Capitals if you want to. That's open to anyone who's interested in retrofit, whether you're a professional or not, or you just have general interest. So that's open to all, and that's just over a year away, so plenty of time to get ready for it.
I would also say that we are a significant provider of training within traditional building skills and related, and so a big part of that, obviously, for those people working within the crafts, within the heritage sector, is that retrofit agenda, and it's something that we embed and try to embed within our training as well, and certainly something that a lot of our alumni and craftspeople and tutors is a space that they're also working within. So I would say this is very much a journey that we are on in an educational sense as well.
Yes, here. The microphone's just on its way.
Hi, I'm just wondering, so is there a lot of interest in these heritage crafts? Do you see a lot of youngsters coming to?
Hugely, yeah. I mean, we're certainly quite heavily oversubscribed. So without going into a bit of too much detail, one of the, I think we have 6 million pre-1919 buildings in the UK. They were traditional buildings, give or take. Something like a third of craftspeople near retirement age, something like 2/3 not passing on their knowledge or skills at the moment. We've been teaching traditional building skills, conservation skills, heritage skills for 35 years. And we did a review recently, and 80% were still working in the sector, but I think more importantly, 60% were actively involved in passing on their knowledge and skills. And I think for us that's quite fundamental. We're not just training the next generation of practitioner, we're training the next generation of teacher. And so our programs are structured that they take, let's say, around a dozen students a year, quite purposefully across disciplines. So on one of our programs, they'll join us for between 9 to 12 months, post-college usually. Although we do have programs that are more foundational in level. They would come to us for between 9 to 12 months across disciplines. So on our programs we have stonemasons, joiners, stained glass artists, thatchers, plasterers, huge range, including architects, importantly. And the courses are completely free. They get paid a monthly bursary of £1,600 a month, so there's no sort of financial obstacle to participation. All the programs start with a 3-week interdisciplinary summer school, which is not just students on our craft programs, but external students from the fields of architecture, engineering, urbanism, the applied arts, the decorative arts, with this idea that place creation is about more than just craft and construction, right? And I think so often, not to go down a silo, or a sidetrack, but so often in contemporary practice, you feel a plaster, you come in and you do the plastering and you leave, right? There's very little opportunity for knowledge exchange, for shared learning, and therefore for creativity, for experimentation, and for evolution of these areas. So it's not just about looking backwards, it's not just about the preservation of our 6 million heritage buildings, it's about how do you design sustainable new construction as well. After that summer school, all the students participate in what we call a live build project, and that can be a retrofit at times, it can be a new build, and that is where they work together as a group across disciplines to build a new structure or restore an existing structure. But because of that, it forces them to work across trades, across disciplines, to understand how other methods work, how other materials work, how you engage with other craftspeople. If they come in as a stonemason, they're not leaving as a joiner, but they're understanding the method, they're understanding the materials, they're having those conversations. It's similar with architecture. But then we send them around the UK, so they spend 6 months traveling the UK, learning under master craftspeople, working on leading heritage sites, working with the leading traditional building firms and sustainable new construction firms around the UK, leads to an NVQ in heritage skills. And we've seen an incredible demand for that, but what we've seen as a demand for that is directly related to the interdisciplinarity of it. They're getting exposed to drawing, they're getting exposed to, we have students who come in, we teach life drawing for almost all of our courses, and we have students who come in thinking, well, I'm a stonemason, right? What relevance does this have to me? It actually has a profound impact on the way you think, on the way you approach your design, on the way you approach your engagement. And so it's things like that, that what we find is that those who will come to our programs are interested in more than just the practice of their trade. They're interested in understanding how they can create a more sustainable environment, or how they can create a more integrated approach, or whatever it may be, but it's more than just the practice of craft. And so sorry, that was a very long-winded sidetracked answer, but it was, yes, we have heavy demand, but also I think that demand is coming from a really interesting place, which is probably a whole other lecture.
Could you confirm on a point of detail what you use traditional materials like lime mortar and lime plaster? That's it.
Yes, yes. I mean, I can certainly, from an educational perspective, that is what we are teaching, and working with practitioners in that space on things like our student building projects and things like that. That is very foundational to what they're doing on a lot of our restoration and other projects as well. I mean, we do often, teach that there are, in certain contexts, challenges with some of these. We are very open about some of the challenges faced with using these materials, but I think it's fundamental to our programs that the traditional materials sit at the heart of them.
Thank you.
I should say we work with a lot of, whether that's Historic England, SPAB, all of the other, we work quite closely with a lot of the heritage organisations, Environment in Scotland, and all of that.
I'm an occupational health physician in the NHS, and we haven't really got very good measurements of workability, I guess, but we do try and measure workability. I wondered if you did any work on, I guess, increasing people's health and happiness at work through these projects, but I'm thinking about ordinary workers as opposed to sort of people that can access your projects. So, I don't know, NHS staff, for instance.
Yeah, well, it's interesting you say that. So I think to go back in the journey a little bit, I think when we worked with, obviously, with the local NHS to found the centre, and that relationship then built to where all the referrals come from local NHS. But what was interesting is actually post-COVID that we had a conversation with the East Ayrshire Health and Social Care Partnership, and then as part of that dialogue, started providing every Thursday afternoon wellbeing services to their staff and to those working across the East Ayrshire Health and Social Care Partnership. So to give that very specific example, yes, we work with industry partners and others who are maybe engaging with us around our education programs or others in that sense as well. And of course we try to embed it within our own work and our own workforce as well. But
did you measure their work?
Short answer, no. No. Short answer, no.
Yeah, you need to start doing.
Yeah, I mean, it'd be interesting to have a conversation with the Social Health and Social Care Partnership to see maybe they did. But no, we simply provided the service in this case.
Yes.
Going back to your skills training, once they've been through your courses, presumably they go on to work as apprentices or something like that with craftsmen. Do you give those craftsmen to whom, with whom they're working, any sort of support? Because it actually takes quite a lot of time to train somebody up.
It does.
And it is a huge barrier.
It's a massive barrier, and I think it's a reason why you have a lot of that. To my previous stat, a lot of people not passing on their skills and knowledge is certainly not from a lack of interest in doing so. Right? It is because whether that is the qualifications system, whether that is the economic system, there are huge obstacles to doing that. One of the reasons we structure our programs like they do with those long-term 6 to 9 months of placement periods is because that enables us to take all of that challenge away from the craftspeople. The students spend 9 months with them focused just on learning, just on passing on skills, not having to worry about the financials, the qualifications, anything like that. Once they leave us, I would say we are able to provide financial support, although we can provide access to projects and things like that. But we do have a really strong network of providers and engagements that help build, upskill, provide access, provide support. So if we had unlimited funds, it would be amazing to be able to continue that support in perpetuity. We don't. But what I would say is that I think what helps is that the students, when they come onto our programs, already have a pretty strong skills base. By the time they leave after a year, and particularly it's because they've spent a long time with these providers, I would say the vast majority, certainly the majority of our students who go on placements end up being employed by one of those placement providers because they've passed on that knowledge or skills, but also understand their ways of working and their engagement. So it is part of a solution, it's not the full solution. There are a lot of challenges facing that sector. But I will say thankfully. Once someone takes one of our students once, they do it almost every year. And we have this incredibly strong network of everything from individual sole traders and craftspeople to large organizations working on major projects who are desperate for these entrants to the sector, and desperate for these entrants to the sector to have an understanding of that more interdisciplinary, integrated approach as well. So it's not just, yeah, so yes and no, I suppose, is the answer to that.
Yeah, but yes, another question if you, yeah, the mic is just coming.
So you've been mostly talking about architecture and places and design and these sort of things, but on your slide there's also wellbeing program evaluation, social prescribing and social factors. And where do you get, so are you incorporating here with sociology and experimental psychology, or where do you get that body of knowledge from which you need in order to evaluate a kind of psychosocial impact of a place?
Well, I think kind of going back to why this whole thing is starting, and I will say this is, you're hearing it here first, right? This is at the start of this at Dumfries House. It's very much, at the moment, a convening of practitioners. It's practitioner-led for the most part, and that's practitioners across sectors and across areas, and it's working with well, everything from gynecologists to dietitians to, so it's, I would say at the moment, a lot of our engagement around integrated health is working with practitioners in that space. I think what we're hoping is that through this initiative, we can bring in the more formal research side of that. I will say we do that, you know, really growing partnership with people at places like University of Strathclyde and others who are looking at some of these themes, but we've never really formalized it in that way or done it in a systemic way, and hopefully this is the first chance that we can do that. And if there is anyone in the room that would like to be a part of it, right, I'm sure we would love it, particularly if you're working in those areas. So I would say that is the impetus for this, as opposed to something we're already meaningfully doing.
Any other questions? Just to say also that, in fact, if you're interested in these themes, the Global Centre on Healthcare and Urbanisation runs a seminar series in partnership with the King's Foundation. The seminars take place twice a term here in the hub, so anyone in and around Oxford, they're open to the public, free to attend at 5:30, twice a term on the first and last weeks of the month, of the term. So the one coming up is on Wednesday the 15th of October, very much in line with the King's Foundation's interest in this PhD DPhil scholarship programme. The title is, Does Designing and Building with Nature Improve Our Health and Wellbeing? So we'll be discussing that in more detail at the seminar on the 15th of October, and as I say, free to attend, do come along and join the conversation. There'll be 4 practitioners and researchers discussing that, and then open to the audience for discussion. So do join us for that if you're around in Oxford, in and around Oxford.
And an open invitation, a bit harder one to achieve for many of you, but if you ever would like to come to Dumfries House, it is a truly spectacular place, and I say that not just because that's where I'm based, but and it's open and free to the public 24/7. Come walk your dog at 4 a.m. if you want. So please do come, and if you do, you should find a way to get in touch with me, and we'll give you a bit of a tour and show you what we do. Yeah, I think it's a wonderful place. So we'd love to have you there, and you maybe be able to see a bit better than I can say. My final cliche of the day is seeing is believing, and it is very hard to describe a place like Dumfries House, so come see it.
Do you want to?
Oh, I was just going to say, no, sorry, yeah, sorry. No, I was just going to say we're drawing to the end now, so I'm sure that most of you have been meeting minds all day, so you're probably very mindful at the moment. You've both actually said the final 2 points in terms of the seminars that are here in this room. All those issues will be discussed here over the coming year and hopefully the following years as well, particularly around research doing in Highgrove. And the GCHU team spent some time at Dumfries House, and really is quite amazing. And then the gentleman asked about access, and one of the key things we learned is that something that the house on the hill that many people never went to suddenly became very much part of the community health service, active leisure time, etc. So thank you, this is why I stood up, just to thank you, Simon, for travelling south to join us, and Juliet for travelling from Cowley to come and speak to us tonight, and thank you all for spending your time, which I hope has been a very full and enjoyable day, and hope to see you back here soon at Kellogg. Maybe on Wednesday the 15th at 5:30 p.m. for the seminar to discuss hybrid research, so you're all welcome. Okay, thank you everyone, take care.